So, safe surgery for every child. This is our this year's National Pediatric Surgery Day theme. So, in this, I want to make it very clear regarding some of the problems where parents will be facing so many problems. So, it is not only about the child problem and child surgery, it is little bit about the parental support that we should give. So every parent, every family requires little bit of some more emotional support. So that is also responsibility of a pediatric surgeon, and we take care of all the kids and the families together, and it is our promise. So from KIMS Cuddles, we started this initiative of doing this. We started one new program called Pediatric Colostomy Support Group. This group main motive is to support the families where though they are handling a colostomy child. So managing a colostomy child is not easy. And in the coming slides, I'll talk a little bit about what is colostomy, how actually we'll do, and why parents require support. So I am Yog Nagendhar, pediatric surgeon, and along with me, Dr. Manisha, Dr. Avinash, and Dr. Ashish. We are four pediatric surgeons. We'll be covering KIMS, Secunderabad, Kondapur, Gachibowli units, and we'll be taking care of all the babies along with the kid. Giving some emotional support to the families is our prime motive. So recently we celebrated our National Pediatric Surgery Day. In this National Pediatric Surgery Day, we started the Pediatric Colostomy Support Group as an initiative from KIMS Cuddles, and we are going to support the families. So just coming to talk about what is colostomy, or for the matter of fact, colostomy, or actually be it ileostomy, or any stoma. Stoma means actually where we'll be bringing out one uh, intestine to the exterior so that the intestinal fluid will come out from that hole. That is what is called a stoma. So, for example, in an anatomical malformation child, so where imperfect anus means there is no anus at birth. In these male children, there is no outlet. So intestine, the baby should pass motion from somewhere, but there is no opening. So then actually, because as a temporary remedy, we do what is called as a colostomy, where we bring out the intestines to the exterior, and then we'll so see that the motion will come out to the exterior by any means in the initial period. So, but why stoma? Why not doing a main procedure? The problem is the stoma is done because the baby is very small. That time, the baby is not ready to take such a major operation. That's why we do a stoma. So, but there are some conditions where we can directly do the primary anastomosis also. But in children where it is not possible, we'll try to do a stoma, colostomy. And there is one condition called Hirschsprung's disease. In this Hirschsprung's disease, there are absent ganglion cells. It is a developmental defect. The ganglion cells are absent. That's why the intestines are not ready to move completely properly. So intestines will be moving to one extent, but where ganglion cells are not there, that segment, it won't allow the motion to go easily. So in the bargain, the intestine above that will be doing so much of work and it will become very big. So there is no other way. Actually, we have to do a colostomy, means it is a diversion of this intestine to the exterior temporarily, and the size of the intestine will shrink. The anal orifice area because the sphincters will get damaged. So that's why we do stoma for a Hirschsprung's disease in the initial period in most of the cases. But of late, actually, we are doing what is called as a primary transcendental pull through, where we'll be preparing the intestine and we'll be doing the primary procedure without a colostomy. That's a very, really good boon for our families. But unfortunately, it cannot be done in all cases when active infection is there. When the intestine size I told, actually it can be small or big. If it is too big, it cannot be done to handle a big operation. So then also we will just do a simple diversion procedure, which is the colostomy. where intestines are getting infected. So then also we do a stoma. So um, it can be a simple stoma like a colostomy, or it can be a stoma in the small intestine, which is called as ileostomy. So whatever it is, we'll be doing one stoma, and then we'll be diverting the uh, in digestion material or the fecal material to come out, and it is quite common to do in NIC, necrotizing enterocolitis, also a stoma, which is just temporary, and we will be reversing it whenever it is necessary. So in trauma, sometimes actually, so just to help the stoma or whenever bad infections are there. So sometimes in interstitial perforations, the patients can present with, and then also we try to do the primary procedure. But whenever if it is very bad and if the patient's life is at threat, then definitely we'll try to do a diversion procedure, what is called as a colostomy or a ileostomy, and then we'll be doing the reversal operation at the appropriate time. That will be decided by the pediatric surgeon. So most of the conditions, whatever I'm talking about, they were uh, congenital malformation. Congenital malformations, you can understand, the mother just delivered the baby and the baby is undergoing this surgery. First of all, after the delivery, the mother will be under so much of stress. She can't handle the baby only properly. At this postpartum anxiety time, and then we are adding to this one more doubt or one more fear of colostomy or an operation for the baby. So this is going to add more to the postpartum anxiety which the mother is already undergoing through. So often it is underestimated. Whatever the intensity of this problem is underestimated by most of the people, including the husband also. He also won't understand what is this postpartum anxiety. But as doctors, we treat the mothers also. That's why we know what is postpartum anxiety, and we see that the mother should not undergo this. Mother should come out of this, and that is when the mother requires that emotional support by the pediatric surgeon, as we are trying to discuss in this topic. So, who is home alone in this period? It is the mother, because the father is busy handling the baby, the family is busy considering about the operations, whatever, be it emotional, financial, whatever positions. So, during these times, mother is literally not able to see the baby also because baby is in the hospital. So, all these things actually are going to add the mother might be facing. So it is often underestimated. This is what I wanted to highlight. So one thing we should tell, I tell all the families, apart along with the mother as well, whenever time comes. So stoma is not a stigma. Because there is a stoma, you should not think that it is a stigma for the family or the for the baby or the for the community. So that is the reason actually why we should have come up with open conversations. So with open conversations, we'll talk about stoma, and people will be able to understand. Maybe they'll be giving some positive highlights as well. This conversations with the families, they reduce the parental fear significantly, which is very, very important. And the parents will be having their fears. And first of all, operation stress. Over that, a colostomy, how to handle, can I handle at home? Will the mother be able to handle? Should I call one nurse or someone to take care of all these things? So all these doubts are there in the parents' minds. So that's why, if at all, if you are able to come up with open conversations and discuss with the peers at least, then you will be able to understand that I am not alone in the process of this stoma or this colostomy or any stoma for the matter of fact. One bottom line for all these conditions is this trauma, what we do in children for congenital malformations or infections, is just a temporary procedure till we do the reversal definitive operation, which we plan exactly whenever it is feasible. Usually, it is within the first birthday of the child itself. So, that this stoma is going to be only temporary and it is not a permanent procedure. And within the first birthday, the child will be comfortably and happily cutting his cake happily with the families without a colostomy. This is going to be our promise for all the kids of and families who are dealing with this colostomy. So parents, like I told, so many doubts are there, so many fears are there, so many concerns are there. So all these things actually we address in our consultations. Let it be first, second, or third, or any number of consultations you can have with us, because parents should be able to understand, and parents should get the confidence telling that yes, I can handle this. Only then we can hand over the baby to them comfortably. So what are the benefits of doing this family counseling? So it is often underestimated because a doctor will be treating the patient. So it is not, pediatric surgery is totally different because we are not dealing with one child only. We are dealing with a child and a maternal side family and a paternal side family. So all these family members should understand. So and all should come onto one page, and when they get the confidence telling that yes, we can handle this problem, then only the journey of the surgery for a child is going to be smooth. So that's why we do this family counseling in the first consultation or second consultation, and definitely before the surgery and after the surgery as well. And only after the family is able to understand, we'll confidently tell yes, now the family is ready, they can handle this baby well. So uh, I always tell, when the patient is under my knife, the baby is my baby. So when we are going to give our baby to back to you, that is when actually we should get the confidence that you are going to handle our baby very well. So overall, the kids' uh, care is very important, and the family is the next set of people who are going to handle this kids surgery babies. So but in family counseling, what happens is the communication will be better because you'll be asking, family will be asking actually what are all the doubts you will be having. And then we'll be trying to answer all the questions, and then we'll try to reduce your tensions and clear all your doubts. And in this way, the empathy between the members also will increase. Not only with relationship with the doctor, it is relationship with the family members also. Because a father should be able to understand what mother is doing. Mother should be able to understand what father is trying to do. And in the similar way, grandparents, uncles, aunts, everyone they all should understand each other, and then only they can give a better care for the family. So in this way, in the bargain, actually, their emotional bonds also will increase. And overall, actually, this is what we are talking about is the co-parenting strategies, so that you should, sharing of the work should be done to run a smooth family. So this way, now the baby surgery preparation is done, and you are ready to handle the baby post-operatively also. So at KIMS Cuddles, we take it as a primary motive, telling that we are going to support the family. That's why we do a detailed counseling. So we believe every family deserves a safe space to heal and grow. So that's why in KIMS Cuddles, we before and after operation, because once we are and taking surgery as a priority, so before also they'll have some doubts. So after the surgery is over, the parents' doubts will be totally different, and it is to the next level. So we have to counsel the families from both angles, before and after surgery also.